Hello, everyone, and welcome to this audio podcast. As part of a laboratorial news. This audio podcast is part of a Hella LabZtorm. This audio podcast is part of a browser, and this audio podcast as part of a Storm Robotics production. In this audio podcast, Synopsis, there'll be an overview in around peer reviewed and published works from 2020. Um, in around works, peer-reviewed and published works from 2020, looking at is there a need for healthcare scientists and educational support surrounding CKD or chronic kidney disease and laboratory investigations and tests, and sort of summarizing some poll-based data from a social media platform, the Renal Patient Support Group, or the RPSG. In this collaborative works and peer review published works from 2020. The overview is as thus. Patient access to information support to supplement understanding of laboratory and test parameters remains challenging because of medical and scientific terminology. These challenges have led to investigating sort of new or novel and efficient ways of approaching education and information support for patients with long-standing conditions such as chronic kidney disease (CKD), and the investigation aims to explore the perspectives on educational support surrounding CKD laboratory investigations from a sample of service users through the Renal Patient Support Group social media platform. In around this works, the research team conducted or carried out 5 polls from January 2018 around 2018 to July 2018 through the RPSG's closed social media platform to understand the importance of healthcare science educational support for laboratory tests and investigations. The target of this study, the investigation, was to sort 1,000 responses from at that time around 8,000 service users or members of the social media platform. A total of 574 RPSG members participated in polls representing a 7% response rate. 77% of respondents agreed that access to healthcare scientists in primary care would be advantageous. When asked about sort of tech solutions, when asked about what tech solutions are available amongst primary care, so for example, through general practitioners or through transplant based units, a portal allowing access to medical records and laboratory results scored the highest, and respondents select where respondents selecting this choice, addressing a remote a sorry assessing a remote assessing or accessing a remote healthcare scientist through a computer or application was selected by around 33% of the health of the respondents. And CKD patients can get confused, can unfortunately get confused with regarding to the laboratory investigations accessed by a mix of healthcare, owing to laboratory investigations being accessed by a mix of healthcare professionals. Healthcare scientists should educate patients about laboratory investigations. So the polls conducted or carried out added value to an important topic of healthcare scientists' involvement in education, in educating CKD patients about laboratory investigations. Currently, there's more scope for healthcare scientists to provide support to CKD patients with smarter education regarding laboratory investigations and parameters. Some terminologies to identify similar works similar works include educational activities, statistics and numerical data, chronic kidney disease, data collection methods, and biochemistry and biochemistry and nephrology. Um, uh, there is in there is there's an audio there is an audio podcast that goes into this in as part of Storm Robotics production in sort of in one sort of audio podcast. However, in this audio podcast in this audio podcast series, this peer reviewed and published publication, peer reviewed and published works from 2020 in this audio podcast in this audio podcast will be looked at in some in varying parts as part of this Storm Robotics production. That draws this synopsis to a close. This synopsis is part of a laboratorial news. This audio podcast as part of a LabZtorm. This audio podcast as part of a Crowell Brolder, and this audio podcast as part of a Storm Robotics production.